Good morning, and thank you for joining me today as I publish the second and final report of the independent review of maternity services at the Shrewsbury and Telford Hospital NHS Trust. My name is Donna Ockenden, and I am the chair of this independent review. Before we start formally today, I would like to pay tribute to the families whose voices and stories are central to this review of maternity services. What happened to you and your families, your babies, your wives, your daughters, your sisters and your partners really matters. And those experiences will ensure safe maternity care for all going forward. Leading this maternity review has been the biggest privilege of my life. It will remain with me forever, and I would like to thank all of the families for the trust that they have put in my team and I. The families have asked me to thank the many journalists gathered here today. They have told me how important a role many of you have played in getting their voices and stories heard. They have asked me to thank you all for your professionalism and your kindness. They have told me that some of you cried along with them on hearing the accounts of what happened to them. Your support has been so important to them, and thank you on behalf of the families. In these circumstances and in this place, there are families who have bravely decided to attend, and I know that you will understand that they have a reasonable expectation of privacy. So may I ask all of you as journalists, particularly as far as photography is concerned, to please wait to be approached by families. Thank you so much for understanding. Today, I also wanted to pay tribute to my wonderful clinical review team. Since the review started, we have had more than 90 midwives and doctors working within this review, ensuring that the report you read today is underpinned by hundreds of years of combined midwifery and medical expertise in delivering safe maternity care. Thank you. The last 2 years have been the toughest in memory for our NHS, at a time when the pressures of COVID-19 have been unrelenting, and teams, including maternity teams, have been stretched beyond all expectations. Maternity services, along with their other NHS colleagues, tell me they are exhausted. Our NHS has endeavoured to give of its very best, looking at how it can deliver services in new ways to provide the best quality care for its patients. We are right to be proud of our NHS and staff that have given so much of themselves over this time. But today I'm here to describe a different scenario. I am here to talk to you about the Shrewsbury and Telford Hospital NHS Trust, a trust whose maternity services failed both families across Shropshire and sometimes their own staff over a prolonged period of time. This final report follows on from our first report, which was published in December 2020. In the first report, we outlined the local actions for learning and immediate and essential actions to be implemented at the Trust and across the wider maternity system in England. This second and final report builds upon our first report. All the local actions and immediate and essential actions within our first report remain important and must be progressed. For this second report, my independent maternity review team have identified a number of new themes which we believe must now be shared across all maternity services in England as a matter of urgency to bring about essential change which will in turn improve safety. From our review of all cases that make up this final report, we identify 4 key pillars to drive forward improvements in maternity services at the Shrewsbury and Telford Hospital NHS Trust and all other trusts across England. These are safe staffing levels properly funded, a well-trained workforce, learning from incidents, and listening to families. Whilst progress has been made in some of these areas, there must now be a fully funded and then concerted effort by all NHS trusts across England to ensure that these 4 pillars are the foundation, the roadmap and the blueprint of all maternity services going forward. Since the publication of our first report, the government has introduced a range of measures and invested very significantly in maternity and neonatal services across the country. This includes £127 million of funding announced last week. Much of this funding is for workforce expansion, improving training and improving culture in maternity services. NHS providers, as cited in the recent Health Select Committee report, has estimated the cost of full expansion of maternity services workforce to be between 200 million and 350 million, which is significantly more than has already been committed. We, the Independent Maternity Review Team, fully endorse and support this view. Our final report spans the period from 2000 to 2019. However, we are deeply concerned that families continue to contact the review team in 2020 and 2021, raising concerns about the safety of maternity care they have received at the Shrewsbury and Telford Hospital NHS Trust. Some of these recent families contacted us with reports they wanted to share with us. We haven't been able to include them fully within the review, but what we have seen is that the themes within their reports seem to echo concerns we have previously seen during this review. Seeing these repeated themes is a cause for grave concern. It is clear that there are a number of areas of maternity care where the Shrewsbury and Telford Hospital NHS Trust still has significant learning to undertake. As you may know, this review was commissioned by NHS Improvement at the request of the then Secretary of State for Health and Social Care, Jeremy Hunt MP, in 2017. The number of cases within this review grew from 23 and then to more than 1,000 families. It has previously been reported that this review was considering 1,862 family cases. However, after removing duplication of recording and excluding cases where there were unavailable hospital records or we could not get family consent for participation, the final number of families now included is 1,486. Some families had multiple clinical incidents, therefore a total of 1,592 clinical incidents involving mothers and babies have been reviewed. This includes a very early case from 1973 and the latest case from 2020. We now know that this is a trust that failed to investigate, failed to learn, and failed to improve. This resulted in tragedies and life-changing incidents for so many of our families. Our team have reviewed all clinical cases. Where we have found good practice, we have said that clearly in the report. However, my review team is concerned at the significant number of cases that fall into categories 2 and 3. These are cases graded as having significant, category 2, or major concerns, category 3, in the maternity care provided. When reviewing the stillbirths and neonatal deaths in the time period 2011 to 2019, the review team found that 40% of the stillbirths reviewed by us did not have a trust investigation. In the same period, 43% of the neonatal deaths reviewed by us had not had a trust investigation. You will all know that without investigation, we cannot understand what may have gone wrong, and we cannot learn. Without learning, we cannot improve maternity care for the future. I would now like to talk you through a timeline of some events at the Trust, and clearly this is described in greater detail in the report. Today, and with permission of our parents, I would first like to tell you about baby Olivia, who died shortly after her birth in 2002. Her mum repeatedly tried to raise concerns about failings at the Trust, hoping someone would do something. 4 years after Olivia's death, in 2006, her mum went on the This Morning show. Olivia's mum told me that over all those years raising concerns, she felt like a lone voice in the wind. At the same time as Olivia's mum was appearing on TV, other families also suffered the deaths of their babies, and only then did the Healthcare Commission review the trust. It failed to take the necessary action. This was a missed opportunity for the trust to learn. The external scrutiny of the trust had clearly failed, and this is a theme that has been repeated again and again over many years. So many parents have told us they tried to raise concerns, but they were not listened to. Eventually, through the tremendous achievements of Rhiannon Davies and Richard Stanton and Kayleigh and Colin Griffiths, following the deaths of their daughters Kate and Pippa, Kate in 2009 and then Pippa in 2016, the required scrutiny has now taken place. The voices of families are now finally being heard. Our team want to highlight that in the 8 months before baby Kate died, there were 2 other incidents at the trust where babies also lost their lives. These babies have been named in our report and will be named today with the permission of their parents. They were called baby Joshua and baby Thomas. In the case of baby Joshua in 2008, almost identical mistakes were made in his mother's care and in his care as those that were made in the care and treatment of baby Kate and her mother Rhiannon. With baby Thomas in 2009, there were gross failings in the care provided, and yet the trust did not tell the truth to the family. The review team is particularly concerned by the lack of transparency internally within the trust, as well as the lack of honesty and transparency shown to families. This is all the more concerning when it is clear that major issues in safety were apparent in both midwifery-led unit and consultant settings during the period leading up to the birth and death of Kate Stanton Davies, and before her, the birth and death of baby Joshua and then baby Thomas. Unfortunately, these cases were not isolated incidents, and through the time span of our review, we have found repeated errors in care which led to injury to either mothers or their babies. We have fully reviewed the cases of 12 mothers who lost their lives giving birth at the trust. 75% of the cases of maternal death have been graded by our team as categories 2 and 3, with significant or major concerns in the care provided. Unfortunately, and overall, our report describes that a significant number of mothers and babies received care that fell way below the standards expected, and this continued throughout the whole period of the review. The review team has also found evidence of significant underreporting and cases that should have been investigated and were not. During the period this review looks at, we are aware of 8 external bodies who inspected, visited, assessed or checked upon the trust. This was a trust with significant problems, and whilst independent and external reports often indicated that the maternity service should improve its governance and investigatory procedures, this did not happen. The trust was of the belief that its maternity services were good. They were wrong. The Trust's executive team and board had continual change and churn over the period of this review, with multiple different board chairs and chief executives over the time period we considered. This constant change led to an inability to deliver service improvement. The Trust board didn't have oversight and didn't have a full understanding of the issues and concerns within maternity services. This resulted in a lack of strategic direction, no effective change, and no development of accountable implementation plans. Our consideration of clinical governance processes and documents at the Trust has shown that investigatory processes were not followed to a standard that would have been expected for the particular time the incident occurred. Unfortunately, the review believes failings have persisted in some investigations as late as 2019 in the cases we considered as part of this review. Although independent and external reports consistently indicated that the maternity service should improve its procedures, governance and investigatory, this message was lost in a trust which was struggling with other concerns. This meant that consistently throughout the review period, lessons were not learnt, mistakes in care were repeated, and the safety of mothers and babies was unnecessarily compromised as a result. We spoke to staff members at the Trust, and documentary evidence also considered by the review team showed us that following serious incidents, there would be no follow-up from recommendations made. One staff member told us, this wasn't just a maternity unit in chaos and under pressure, this was a whole organisation where it was difficult to find an area which was not under pressure. Another member of staff told us there was a republic of maternity, where often the maternity service seemed to consume its own smoke and didn't like having oversight by the corporate team. We are very concerned that in very recent weeks, staff currently working at the Trust have contacted the review team to express their concerns about maternity services at the Trust in the here and now. Staff have described to us that they were frightened to speak to the maternity review team and were advised by Trust managers not to participate in the Staff Voices initiative. One staff member said to us, and this is a message for the families, I am sorry, and I know that sorry is not enough, but by engaging with this review, we hope that our voices will finally be acknowledged and that change will happen so that there are robust and independent places for clinicians to speak out, that acknowledge what we are saying, what needs changing, and that we act on this without fearing reprisals. Another said to us very recently, and by very recently I mean March 2022, if I could say anything to the families, it would be that there were people who tried to make changes. We tried to escalate our concerns and be heard, but every process we used was set up not to acknowledge our voices or the problems we were highlighting. We were ignored and made out to be the problem, but ultimately we failed to make ourselves heard. I'm now going to turn to page 184 in the report because I'd like to share with you just a couple of things that staff have told us in recent weeks. And in fact, this was added to the report in the very final days before printing. Section 1.32 will tell you how staff members described a clique on the labour ward at the Trust with a culture of undermining and bullying. Staff members described that this had negatively and seriously affected their mental health. Other staff members described that the behaviour experienced on the labour ward was so bad that they had difficulty finishing their shifts and cried secretly whilst in work. These staff declined for their direct quotes to be used because they were fearful of being identified. And section 1.35 on page 184 says, a current staff member in maternity services at the Trust spoke to the review team in early 2022, but described themselves as fearful to do so. The staff member said, I really had to think very carefully about approaching the staff voices, that's us, when we were told not to speak out. But I will do it and take the consequences because it is the right thing to do. I am clear that there is no support for those that speak up. The Trust has more than 60 local actions for learning arising from this final report. Our review team examined every area of maternity care at the Trust, including antenatal, intrapartum, labour, postnatal, neonatal, mothers who have died, and obstetric anaesthesia, and found that improvements were needed with staffing levels, training, investigations, and learning, as well as listening to families. In addition, we have actions for governance of maternity services at the Trust, as well as how it supports families, particularly the bereaved. In addition, the Trust must improve how it supports its own staff and ensures that staff can raise concerns without fear of reprisals. The Trust must also ensure they continue to make progress on the local actions for learning and immediate and essential actions from Report 1. This is a Trust with a significant amount of work to do to continually improve the safety of maternity care, with their own staff coming forward in the last few weeks to tell me they wanted assurance that the Trust would still be monitored very closely, and that, in the words of a current member of staff, the Trust must show real evidence of change, not just say in the press they have changed. Some of the key local actions for learning, and they are of course included in more detail in the report. Incidents must be graded appropriately with the level of harm recorded as the level of harm the patient actually suffered. Correct investigation processes, procedures and terminology must be used in line with the relevant NHS Serious Incident Framework. All investigations must be undertaken by a multi-professional team of investigators and never by one individual or a single profession. In view of the relatively high number of direct maternal deaths, the Trust's current mandatory multidisciplinary team training for common obstetric emergencies must be reviewed in partnership with a neighbouring tertiary unit to ensure that training is fit for purpose. The Trust must adopt a consistent and systematic approach to risk assessment at booking and throughout pregnancy to ensure women are supported effectively and referred to specialist services where required. All clinicians at the Trust must work towards establishing a compassionate culture where staff learn together rather than apportioning blame. Staff must be encouraged to speak out when they have concerns about care. Can I please stress, these are not nice to haves or maybes, these are must-dos. It is recognised that many of the issues highlighted in this report are not unique to Shrewsbury and Telford Hospital NHS Trust, and they have been highlighted in national reports into maternity services in recent years. This is why the review team has also identified 15 immediate and essential actions which must be implemented by all trusts in England providing maternity services. These are focused on workforce funding, planning and sustainability, safe staffing, escalation and accountability, leadership, investigations of incidents and complaint handling, learning from the deaths of mothers, multidisciplinary training, complex antenatal care, preterm, labour and birth at term, obstetric anaesthesia, postnatal care, bereavement care, neonatal care, and supporting families. What is essential is that the process of investigation, learning and service change from maternity incidents is independently chaired, and changes must be introduced into clinical practice within 6 months of an incident occurring. No longer should families have to chase for the results of investigations. That is not your job to do. There must be a reasonable time frame on learning and practice change when clinical incidents occur. It is absolutely clear that there is an urgent need for a robust and funded England-wide maternity workforce plan, starting right now without delay and continuing over multiple years. This is essential to address the present and future requirements for midwives, obstetricians, anaesthetists, neonatal teams and equipment, and all the associated staff working in and around maternity services. Without this very significant multi-year investment, maternity services cannot provide safe and effective care for women and babies. This plan must also focus on significantly reducing the attrition of midwives and doctors, those who leave, since increases in workforce numbers are of limited use if those already within the workforce continue to leave. This is best explained as you can't fill a bath with the plug out. Clearly, if midwives and doctors continue to leave our maternity services and we do not improve working conditions for maternity teams, there is very little benefit in continually recruiting more staff. To harness the learning from this report and bring together other learnings from across the maternity system, a working group independent of the Maternity Transformation Programme, that has joint Royal College leadership, including midwives and obstetrics and gynaecology, anaesthetist, the Obstetric Anaesthetist Association, plus paediatrics and child health must now be set up. The remit of this group must be to guide the Maternity Transformation Programme around implementation of our IEA's immediate and essential actions and the recommendations of other reports currently being prepared. This investment and work must be progressed at pace and continued for as long as necessary to ensure that no other family experiences the many tragedies described in our report. Only with a robustly funded, well-staffed and well-trained workforce can families and government be able to expect consistent delivery of safe and compassionate maternity care locally and across England. Thank you for listening to me today. Thank you.